So thank you all so much for being here with us today. For those of you who don't know me, my name is Christian Duborg, and I'm the Food and Nutrition Policy Analyst here at the Commission. And I'm going to jump right into it because we have a fantastic panel here with us today. And I want to make sure we give them as much time as we can. The theme of the Events for Hunger Action Month this year is information access. And today we really want to focus on the information that consumers have available to them so that they can make choices for what's best for them and their family. So without any further ado, I will start with our first question, which is we're just going to go down the row and ask if each panelist could introduce themselves and share one uncommon food that you actively seek out. And Olivia, I'll start with you if that's okay.
Hi, everybody. I'm Olivia. I am the Strategy and Community Engagement Coordinator at Connecticut Foodshare, the food bank serving all of Connecticut. One uncommon food that I particularly enjoy is kimchi.
Hi, good morning. My name is Tammy, and I am a member of the Witnesses to Hunger. Well, it's not really uncommon, but my favorite is sweet potato because it's healthy and I don't have to add anything to it. So that's my food. Thank you.
Good morning, everyone. My name is Susan Harris. I'm also a member of Witnesses to Hunger and the Coordinated Food Assistance Network of Greater New Haven, CFAN. I've been looking into the medicinal properties of soursop because I've been hearing a lot, you have all those little ads on Facebook about, the properties and what I figured was it says sweet and sour flavor. It's originally from Central and South America, may lower blood pressure, reduce inflammation, and support digestive health in moderation.
Hi everyone, my name is Maria Gombi-Vaca. I am an assistant research professor at the Rudd Center for Food Policy and Health at the University of Connecticut. And I would say my uncommon and nutritious and healthy treat is a chia seed pudding with coconut cream and strawberries and almonds. That's one of my favorites. Yeah.
That was very specific. I like that. I'm going to have to try that. Good morning. My name is Ben Dubow. I'm the executive director at Forge City Works, where we, among other things, we operate the grocery on Broad here in Hartford. I'm not sure it's uncommon, but these days, whenever I see farro on a menu, I go for farro, and I've been cooking a lot with it and use it in both salads and warm sides and even as entrees loaded with lots of good stuff.
Hello, I'm Claudia Mejia. I'm a registered dietitian with Senior Resources, the agency on aging in Norwich. I also work as a coordinator for the Senior Nutrition Program and the M-Teams, which is working with elder justice. So you said uncommon food, and I'm pretty sure I'm going to gross people out this morning. I seek organ meats. I know that's not a very popular one, and I know my coworkers hear about this all the time. They can be part of a healthy diet, and sometimes I feel like I want tongue or liver or something like that. I think it's pretty great. It's full of a lot of great nutrients, and it also makes me think great that I'm contributing that not all the animal is going to waste. So that's my unusual food. Thank you.
Thank you so much. And full disclosure, part of me asking that question was so I could take notes on what I need to be shopping for going forward. But moving on to the next question. So we're here to talk about access to information for consumers about what's in their food. But I first think it's important to ask, why is it important to know what's in your food? And so Tammy and Susan, I want to give this question to you all.
So my first tip is read the labels. People don't read the labels enough, and there's a lot of misleading information on the front of the packaging. Less ingredients means less processing. So look for foods that are closer to their natural whole state. Avoid added sugars and sodiums if you're managing chronic conditions like diabetes, high blood pressure, and pay attention to calories. It helps you meet your nutritional needs by following the labels and knowing what's in your food, and look for potential allergens like nuts, eggs, dairy, soy, and shellfish.
Yes, similar to what I'm going to say too is it's very important, especially for me, and I'm sure many other people, if there's allergies or even health issues. I do have some health issues like anemia, and I think it's just very important to know what's in your food and what's healthy and not healthy.
Absolutely. Thank you all so much. So Susan, I know you started to touch on this, so this is a perfect segue to the second question, which is, what is the purpose of the food labels and what should we be looking for on the food labels when we shop? And so Claudia, I'm going to go to you first for this question.
Yes, so I love the food label, especially because it's something that is going to give us clarity and choice, right? It's going to give the consumers choices about what products they're going to bring to their homes and how is that going to fit with their nutrition goals. The one thing that I find super helpful and I feel like it's underutilized is the percentage daily value. And I always like to point out this to my clients, people I talk to, especially because I feel it's kind of confusing for a lot of people. So, and the percentage daily value is giving you just kind of like a snapshot, how much one serving of that particular product it's going to add to your daily nutrition goals. It's very simple. So I always like to remind them, if you think about 5 and 20, just think about 5 or less is low and 20 and up is high. So kind of keep that in mind when you're looking for certain nutrients that maybe you need to kind of watch out for or you actually want to increase in your diet. So in that way, you're going to be able to kind of make better choices and compare products to see which one is going to fit better in your diet. And again, the other things, just kind of repeating what Susan was saying, basically looking for added salts, added sugars. Like a lot of products are loaded with these things, and we want to make sure that we are not bringing a lot of those things into our homes. I also like to, of course, talk about protein because, I work with seniors, so it's very important for them to keep enough protein in their diet. So I always kind of want to make sure that they are looking for these things in the food labels. But I think definitely food labels are not perfect, but it's a really good tool for us to kind of help our clients make better choices.
Absolutely. And do you mind if I ask a quick follow-up question? Yes. So on the topic of percentage daily values, this is something that always, I know, has confused me, is would you mind just sharing a little bit more about how those daily values are calculated and how they determine what the 100% should be? Yeah, so it is based on a 2,200 calorie diet a day, like calories a day. So I know not everybody kind of has that intake a day, but it's kind of based on that number. So with that number, they calculate the different nutrients that we need, and they just calculate the percentage. Let's say that we're going to need, I don't have this off the top of my head, but the numbers. But on that number, they calculate your needs for all the different nutrients. So there are definitely some nutrients that we want to increase in our diet, maybe protein, maybe some vitamins, maybe, so those things we want to increase, and we want to make sure that those are higher than 20% if possible. And if on the other side, there's some that we want to definitely kind of lower in our diet, maybe sodium, maybe added sugar. So those are the ones that we want to always kind of look below 5%. So if that's kind of 20% of those nutrients, maybe that's a product that we need to kind of stay away from. That makes a ton of sense. And Tammy, I want to go to you with the same question as well. So what is the purpose of the food label and what should folks be looking for when they're shopping?
Yeah, so the purpose of the food labels, just to check to see how much sugar is in there, how much salt, sodium, what you can have, what you can't have. So similar to what people are saying about that, it's very important to read. I know it takes a lot of time to just read a label and stuff, but it's really important to do that for your people who have health issues and diabetes and stuff like that.
Yeah, so I'll chime in here and echo some of the points that we've heard, but also bring in a different perspective from the food bank. So we use a stoplight nutrition ranking system at Connecticut Foodshare. It's called Supporting Wellness at Pantries, or SWAP for short. It's based on healthy eating research guidelines for the charitable food system. And SWAP was created in collaboration with nutrition professionals, folks at the UConn Red Center, and other professionals that came together to create a simple, that was supposed to be an intuitive way to rank an item based on 3 key nutrients. So we take a look at the saturated fat, the sodium, and the added sugar to determine the ranking of an item. And those rankings are green, choose often; yellow, choose sometimes; red, choose rarely. Just emphasizing, if they have high contents of those nutrients or low contents of those nutrients, and how that can support your health. And it focuses on those nutrients because research has shown that, those are likely culprits for chronic conditions like diet-related diseases, high blood pressure, high cholesterol, diabetes. So that's why we take a look at those 3 specifically to then give the overall ranking of a food item.
Thank you so much. And I think that's a really important point as well, of noting that some of these ingredients are very explicitly linked to those chronic conditions, which makes them especially important to track. So we've talked a lot about the food label so far, and it provides a lot of really important information, but it doesn't necessarily encapsulate everything you might need to know about foods. And there are some terms that are often used, like ultra-processed foods, that may not be easy to spot based on the label. And so, Dr. Gombi-Vaca, I'm going to start with you with this question. So, would you mind just giving us a little background? What are ultra-processed foods? Are they always harmful? And how do you spot them?
Yes. So, simply defined, ultra-processed foods are foods that are made in factories, and they usually are a combination of ingredients that you do not find in a home kitchen or in a restaurant kitchen. So these foods are generally presented in sophisticated packagings, and they are designed for mass appeal. So I would say that the way that ultra-processed foods are formulated, they are usually combining substances that are obtained from foods, from whole foods, but then those substances are combined, are modified, and then are assembled in a final product that usually has added other additives that you call cosmetic additives, that are usually with the function to bring a color or flavor or texture to these foods and make them more appealing. So this is, and you can think about examples of those foods. I think that all comes to our minds, the most common ones, but all candies and chocolate bars, but also like the soft drinks, sugary beverages, and also part of these, the breakfast cereal, and other foods that contain those additives. So in terms of how harmful they are, I think we know that the ultra-processed foods category is have a diverse combination of foods. So not all of them are going to have the same nutritional value, but we think about the ones that are the most harmful are the ones that are full of those additives, but also has excessive amounts of sugar, salt, and fats, and the combination of these are with the purpose of make those foods super tasty. And that's when make it harder for stopping eating them. So I think this is a key aspect of ultra-processed foods. And when you think about those most harmful are just the ones that I just mentioned, those candies and those processed snacks. And think about all those foods that really people eat without stopping or want to eat more. And those are designed to be consumed in that way. So, and then just to give a little bit more of context or how we at Public Health, we are concerned about those foods is that traditionally we are looking at how foods are, the content of foods to associate their consumption with health issues or health problems. So the thing is, traditionally you're looking at what are the components of foods? Is that the sugar? Is that the fiber? Are those fats that are associated and causing all of those health issues? But when you're looking at ultra-processed foods, we change the way we look at foods. We're looking at we're looking at the whole food system to understand how foods are made, how they are processed before they get to our table. So I think this is something that is being adopted. This framework has really been used by researchers based on a framework called NOVA, which is a framework to categorize foods by their level of processing. And what we've seen in the body of evidence is that these foods across different age groups and in different countries, the highest levels of consumption of ultra-processed foods in diets are being associated to 32 health issues. And not only the ones that we think about directly are associated with diets, like diabetes and the cardiovascular diseases, but also cancer and mental problems and also child development. So I think that's where we understand about ultra-processed foods. And just the last thing I want to add is that to spot them is, of course, label is important, looking at the list of ingredients. And so looking at them as, look at the products. And if there are names there in the ingredient list that you do not recognize, they do not sound familiar, it's even hard to pronounce them. So those are the red flags that we are paying attention for consumers to look at this. And finally, just adding that processing itself is not bad. Processing is great. It makes food available. It transforms food so they are edible. But there are kinds of processing that are not good. And those are the ones that are highly processed in factories and adding those additives that really they don't need to be there.
Thank you so much. And I think there's a couple things, a lot jumped out to me there, but I think two things that really, really stood out to me were, one, the just sheer number of conditions. So you said 32 conditions tied to overconsumption of those foods. And that is a pretty substantial impact on not just the health of the individual, but the public health of the state. And the second thing that point you made about some of these foods being designed to be overconsumed. And I know Claudia earlier was talking about the importance of daily value. And I think, I'll just speak for myself, I know that there are definitely foods that when I start eating them, the serving size might be, 5 pieces, and I'm going to end up eating 30. So I think those are really important things to highlight. And Claudia, I wanted to go to you with the same question to talk a little bit about, from the dietitian lens, how do you spot these ultra-processed foods and how do you advise individuals on interacting with them?
And you just remind me, I didn't mention looking at the serving size, but looking at the labels. Sorry, forget about that. Very important part, especially because people end up eating more than the serving size that is on the product, right? So again, going back to the food, to the ultra processed foods, and Dr. Gombi did a great job with kind of explaining that to us. So I have very little to add. I think for consumers and for my clients, I always want to make it super simple. Sometimes people come to you and, everything is processed. Yes, but there are some foods that still are processed, but can bring you closer to your health and nutrition goals, like maybe using canned beans or plain yogurt. Those things are processed, but they can be part of a healthy diet as well. So I always want to kind of go back to the concept, like if the food that you're going to grab looks more like the natural food, like the original food, then most likely it's good for you. And then if you happen to have one of those products that have a bunch of weird ingredients that you don't even know how to pronounce, that you don't even recognize, if you have one of those once in a while, probably it's not going to be that bad. But the main thing is we don't want those products to be kind of the bulk of your diet. We just want those to be occasionally maybe. But then the bulk of your diet should be hopefully the ones that are not super processed.
Yeah, absolutely. Yeah, and I think I'm trying to limit my reflections, but I think you also brought up a couple really, really important points there. And I think that that nuance is really important. I think it's very easy sometimes when talking about foods in general, but especially things like ultra-processed foods. It can be very easy to be like this entire category is good or this entire category is bad. And I think that nuance is important of like, overall the category can be quite harmful, but there are some exceptions to that rule. And I think just as a follow-up question, and this can be open to anyone, but,
Thank you, Christian. I just wanted to ask Dr. Maria and Claudia about fats. And we know about saturated fats and trans fats. Is there a healthy fat that consumers can look for that is more healthful than the processed fats that we deal with every day?
So yeah, definitely the unsaturated fats, the polyunsaturated, those are really good for you. But again, a fat is a fat, right? It's going to have a lot of calories. And we're looking into kind of paying attention to the calories, not eating too many calories, again, because that's going to bump with the issue of obesity. So we want to make sure that we're staying within our calorie goal for the day. But at the same time, those healthy fats are good to incorporate in our diets, definitely. But then we need to make sure that we do those in moderation as well.
Yeah, I just want to add that, fats and oils are important, especially when you're preparing foods from scratch. So when in moderation, they are part of a healthy diet. So I think that's what I want to keep in mind too.
And I think that that's also a very important word in this conversation, moderation. Like I was raised on the phrase like everything in moderation. And I think it goes, Claudia, to the point you were making earlier as well of like, even for these foods that are, ultra processed and harmful for you, it doesn't necessarily mean like you can never, ever, ever have like a birthday cake. It just means like, take those things in moderation. And so I do want to go on to the next question, which we've talked a lot about the label. We've talked about some information that, might be on the label, but might be kind of hard to spot. But like we said, there's also some information that might just not be on the labels at all. And so, Susan, I'm going to go to you first for this question. How do we get beyond labels? So in addition to looking at the label, as a consumer in the store, what should we be looking out for?
As with everything else in our society, most food products have a QR code on the packaging. And if you scan the QR code, it will take you to more information about their processing and their ingredients. And so that's one way to look more into what you're eating. You can also start a health diary to track your personal health and what you are consuming. Another thing is if you want to have more locally grown food, connect with the local growers in your area. I know in New Haven we have the farmers markets every week around the city, and they're popularized by people who have local farms within the New Haven area. Talk to them, and if you want to get something before it hits the grocery store and whatever it is they spray and do, to your fruits and vegetables, talk to them, and make healthy food options more accessible and more affordable to those in communities with limited access. I think those are the ones that suffer these 32 or more chronic conditions that Dr. Maria was talking about because of lack of access to more healthful and nutritious foods. And I think that's a big thing we need to work on.
Absolutely. And Ben, I want to go to you, and especially I wanted to ask if you can also give a little bit of an introduction to the grocery store, and from the grocery perspective, what information is out there that consumers should be looking at while they're shopping.
Sure, absolutely. And so, in our grocery store, Grocery on Broad, we actually have adopted the swap model. So you'll go around and you'll see red dots, green dots, and yellow dots on all the items, which just helps you very quickly make a decision. I don't know about anybody else, but when I shop, I actually don't have time to look. I'm shopping for 30 or 40 items to look at every item. And I come to this as a chef, also as my background. And so when I think about it in a grocery store, and our store set up this way and others, and by the way, our store, it's a fair price model, by the way, so it's a sliding scale, so we try to make food accessible and affordable to people. But I think about it in terms of categories and really simple information. So that's what I love about Swap, right? I can visually pick that up. You mentioned the number of ingredients. As a chef, I rarely am going to buy a product that has more than 5 ingredients listed. I don't even care what the ingredients are, right? So if it's a long list, it's probably not the product I want to use. And so the more products, the more processed it's going to be. Again, coming as a chef, my background is we try to manipulate food as little as possible, right? We want food to be as natural as possible. So like, for example, we flip a steak once. Please don't flip your steaks more often than that. But every time you touch a piece of food, right, you're actually kind of breaking it down. And so every time it goes through more processing, it's the same thing. So I want foods to be in as whole and natural a form as possible. The other thing is that we structure a grocery store in such a way that encourages people to buy a certain way. So if you know those tricks, you can navigate the grocery store well. So I always like to start generally at the perimeters, right? So I'm going to start my shopping in produce and then meat and fish and dairy. And then the other stuff, right, that I need, whether it's the beans and the rice and the grains, but I can skip the cereal aisle, I can do all that kind of stuff, or at least I do most of my shopping before I get to those things. And the thing I always tell everybody is the more you cook at home, the healthier it's going to be. So, people get obsessed sometimes about how much oil is going in or how much olive oil they're using when they cook at home. Yes, moderation. But let's be honest. If you're cooking at home and you're using olive oil, you're already so far ahead in terms of both health, by the way, and tastiness. So again, as a chef, I always believe food needs to be nutritious. It also needs to be delicious, right? And we don't want to compromise that. And so I always think in terms of what's fresh, what's seasonal, what I can get locally, how do I build flavors together? And then I want to be able to at least understand a little bit. And if I can't understand what's on the label and all the ingredients, I'll probably take a pass.
Yeah, absolutely. And again, so many things to touch on, but I think that last piece is really important. And it made me think of earlier this year, the Federal Food and Drug Administration put out a report on their sodium guidelines. And one of the conclusions of that report that really jumped out at me was they concluded that it would be, for American consumers, nearly impossible to meet the daily value targets for sodium because so much sodium is being put into these pre-prepared and ultra-processed foods. So that, I think, really speaks to that home cooking point. And I did just want to ask one quick follow-up before we move on, which is, you mentioned that the grocery store is set out in a very specific way, and that informs how you shop. I'm wondering if you could tell us just a little bit more about how grocery stores decide to set up that layout and what drives that decision making.
So in every other grocery store, not grocery on broad. So in general, honestly, it's about profitability, right? And so they are designed as a marketing space, right? And so those items that are higher margin are the ones that they're going to want to put the most to sell. Now, what's higher margin grocery is not always predictable, right? Because in giant grocery, what you have is you have people paying tons of money in slotting fees and other kind of behind the scenes money changing hands that literally people buying shelf space. And so you might think to yourself, well, how much money can this particular chip make, right? I'm paying $3.79 a bag. How much margin can there be? But what we're not seeing is the behind the scenes as to what manufacturers are paying to get it on the shelves and to move product. And so you can guarantee that when you see end caps, when you see sales and big signs and big displays, there's a reason the grocery store wants to sell those to you, right? And it's, at the end of the day, they're for-profit businesses. And so what they want to sell you is the stuff that's the highest margin, that is getting them the most feet in the door, and will kind of add to the marginalized things. Now, they also want to turn fresh product, right? So they will display that stuff well, and they do know that people want fresh produce. So better stores will give you a mix. But what you want to just remember is that grocery stores are retail, and that by definition, what they are doing is they are trying to market to you in a way that are going to drive sales and, more importantly, drive profits.
Yeah. And you said that produce and stuff is on the edges of the market. Would that mean that those items tend to be lower margin, like the fresh fruits and vegetables, or?
Yeah, so produce is a pretty low margin item. There's also a lot of waste and a lot of turn on that product, right? Because you have to keep it super fresh. And just a little side note, having someone who now, again, as a chef, but also running a grocery store, please remember that produce is delicious and awesome even when it's not picture perfect. The only way we get picture perfect is actually we use lots of chemicals and we use lots of unnatural ways to create food that lasts longer. We don't want that, right? So that slightly wrinkly zucchini or squash is actually better It's going to have better flavor. It's also going to be healthier for you. All those kinds of things. But the American consumer, we've kind of convinced ourselves that any kind of brews, anything that doesn't look perfect, right, we can't buy, which first of all contributes to a ton of food waste, which I know is not our conversation here, but this is all interconnected, right? And so it leads to tons of food waste. It actually drives prices up, right? Because the amount of waste that we go through at the store, we have to accommodate for in our selling. And you're actually getting a more inferior product. The reason that we can buy tomatoes year round that look perfect and are tasteless is because that's what, as consumers, we've demanded based on what we've been kind of fed and shown. The reason that if you're buying local tomatoes, and you'll see they're a little bit bruised, they're not always perfect, right? They can be a little bit ugly, and some folks have figured out how to sell ugly tomatoes, and now that's a marketing thing, right? But the point is they actually taste like a tomato. And let's be honest, they should only taste like a tomato for like 8 weeks, right? That's kind of how it works. And so all those things we need to kind of remember from the business side.
Yeah, absolutely. And I know this is also a completely separate, but also a very important conversation. But like that 8-week period is really can also be a lot easier to meet when we're having stuff that's grown in Connecticut as opposed to having to be trucked across the state or the country. Excuse me. Now, Claudia, I do want to get to you on the same question. So again, from the dietitian lens, what should we be on the lookout for that might not be on the label?
So I always like to talk about my plate. I think it's very simple and something that is going to keep people kind of beyond the plate, the food label. So if you're just kind of having a meal and you're looking at your plate and it's basically mostly carbohydrates, maybe just a lot of rice. So kind of think about the plate and know that it's divided in fourth, and then you need to kind of make it as kind of complete as possible. Maybe adding some protein, adding some fruits, vegetables, and whole grains. So that's kind of basically the other part that I want to add. It's super simple, but I think it's pretty doable for anybody to just kind of pay attention how their plates are formed when we're just having a meal at home.
Absolutely. All right, and now I think we need to...
Christian, if I may, the layout of the grocery store is making me think of SWAP and when we train our partners in using SWAP. So one of the things we try to think about when we're training our pantry partners is how can we lay out your food pantry programs in a way that's going to help promote healthier choices, so those green, those yellow items, but still include the red items because, like we mentioned earlier, no one food is like good or bad. We don't want to shame people in the choices that they're making, but we want to give people this tool for them to be able to use. So when I work with our pantry partners, I try to tell them to think about how you can make the green items more at a first view for people. So like at eye level for like the average person, right? If you have a shelf that's full of canned soups, maybe the green ranked canned soups are on that like more middle shelf that people would see when they're shopping in your space, like right off the bat from the eye level, and then have that yellow still in there, and maybe the red is on a lower shelf or an upper shelf, but it's still there and people can still choose to select that item if they want to. But I try to work with our pantries to think about how can we slightly tweak layouts to, try to help promote the more healthful option. So I just wanted to add that in there as well.
And I just wanted to add on to what Ben was saying about the grocery store and maybe ask his opinion about frozen fruits and vegetables as opposed to fresh. Is that maybe your next best option as being less processed and more affordable for people who can't always afford the fresh?
Yeah, so in general, I always prefer fresh, but I will tell you that IQF, or individually quick frozen vegetables, can be really great. And the process is actually pretty clean in most cases. Again, I want to look at the ingredient list. So like when I'm getting frozen peas, there should really only be one ingredient in there. And I will say as a chef that I actually prefer frozen peas over fresh peas for a variety of reasons. So there's things like that. And I will always take frozen over canned vegetables, which tend to have a lot of sodium and preservatives. But vegetables over non-vegetables, right? So it's always a matter of weighing those options out. But I do think that actually frozen can be a great option.
I wanted to just add something to it. I always want to, again, make it simple for clients and consumers. And I don't want to discourage anybody from getting anything frozen or canned, because sometimes we don't have the budget to buy fresh fruits, right, or vegetables. So if that's within your budget, go ahead for it. Go ahead and get it. But if not, frozen fruits and vegetables in can, they can be as as good and part of our good nutrition. So just make sure again that they're staying close to the original product.
Absolutely. And I think, Claudia, you just hit on a really, really important point. And I think that's exactly the pivot that I think we want to make in this conversation. And to Olivia's point, like the importance of choice. So like, even if, things may be quote unquote healthier or non-healthier, like we want to make sure that every person has the ability to make the choice for what's best for them. But to the point you just made, the elephant in the room is that's not always the case right now. We've talked so far a lot about sort of the ideal world of like, having easy access to fresh fruits and vegetables, having lots of time to read all the labels, having, the budget to go for some of these things that might be slightly pricier, but meet more of these guidelines. But we also know that there are a lot of structural realities that make that hard for a lot of residents. And so, Ben, I'm going to go to you for this question first. What in the food environment exists that's really impacting individual choices or limiting individual choices?
While there are a lot of factors, I think there are two that are the most prevalent. And to me, it's affordability and access, right? And those are very much interconnected, right? Because if things aren't affordable, they're not accessible. But in many neighborhoods, and I'll take our Frog Hollow neighborhood here in Hartford as an example, the reason that we opened the grocery store is because literally you could not find places that sold fresh produce. That's not an exaggeration, right? And so people were shopping primarily at the corner bodegas that were highly processed foods, and maybe some deli was like the closest they got to fresh, but weren't stocking produce and all those kinds of things, or shopping at CVS, right? Which we'll just leave it at that, right? Like very convenience type foods. And so they didn't even have the access to it. Now, the second part, of course, is that you have to afford it when you can't get there. And so affordability is a real issue when it comes to that. One of the things that we know anecdotally and beginning to have the data now about a year and a half in, because we can kind of see what people are purchasing, is that over half of our folks who shop in the store are on the 50% or 40% discount, which are our highest discount levels, and then it kind of scales out from there. But across every level, when given access and the affordability piece, our top selling categories are produce, meat, dairy. And that's consistent week after week, all the time. And so what it continues to show us is that when that food is available and it's affordable, right, and using the sliding scale, it becomes affordable, that is what people purchase and will buy.
I think for me, what comes to mind is we have to think about where people live, where people work, where they play, where they're spending their time, and what are the resources in those environments, right? So can someone drive 5 minutes to a full grocery store shopping experience like a grocery store or a food pantry, or do they need to drive 20, 30 minutes to a different town to get that similar experience? And when we're thinking about that access piece, right, transportation plays a role in that too. Do people have a car that they can go and make that drive? Or are they relying on public transportation? So I challenge you, think about how your grocery haul may change if you have to walk to the bus stop. Now you have to wait at the bus stop. Then you have to ride the bus. Then you have to walk to whatever grocery store or food assistance program you're going to. You do your shopping, but now you have all your groceries and you have to do that route all in reverse. So that's going to impact choices that people are making because of that commute consideration we have to think about. Then I think there's other things too, like what sort of access do people have to various kitchen tools and appliances that they may impact the ingredients that they're choosing to bring into their home. And then, what health conditions or cultural beliefs they have that may influence the food choices that they're bringing into their homes as well. So I think it's very multifaceted. There's a lot of things that we should be thinking about and need to be thinking about.
Yeah, so I'm one of the ones who have to use public transportation to go to grocery shopping, and I shop at like 3-4 different places, and just for price reasons, and it's really hard, because you have to take the bus, and there's not where I live. There's not really stores around, so I have to go out of my way, take the bus, and I can only carry so much on the bus, so I have to go back and forth to the stores, and so it's really a challenge.
Plus, it's getting colder now, so
Right.
the weather will soon be a factor in how much you can get out, if you can get out, and you know how far you can go.
Yeah, just adding that, yeah, the food environment is everything that is around us. So it's not just, it's the availability of food, it's the weather, it's how we get to the food, but it's also everything that is in the food system that we are talking about when we are talking about how to get those foods and the healthy ones that we are seeking for our families. So in that sense, we are in the Red Center also has a big focus on the way that the food environment shape our decisions. And when you think about policies and when you think about the marketing of foods, which is another aspect that is very important, and I just want to mention, especially for the ultra-processed foods that we were talking about. So and there are a lot of studies that we have seen looking at how the amount of money that is spent on advertisement on those unhealthy and the most harmful ultra-processed foods. So 80% what is spent in advertisement is spent on those foods. So this is another aspect of the food environment that we need to pay attention on. And that is not only the packaging that brings like the bright colors, the health claims, and make consumers even more confused about when they need to decide what's the best for them, but also digital marketing, not only on TVs, but the social media that kids and adults are looking at and are being influenced in their decisions to make, to decide what to eat. And just want to add something important in the food environment, and sometimes yes, fruits and vegetables, fresh fruits and vegetables are really important, but sometimes they're not enough. There are some people that do not want to cook. They do not have the skills, or they don't want to have the skills, or they don't have the infrastructure to cook. So I think that another aspect is to really think about how as the food environment could also include affordable and accessible meals that are prepared from scratch, that are made with whole foods, that are made with the ingredients that are safe and healthy, and can be another alternative when you think about what can be done in the food environment. And I just want to chime in what Olivia was saying, that charitable food system is also doing an amazing job, and we at the Red Center, we are witness of this the big effort that they are doing in tracking. And first, it's a lot of work to rank foods, to look at individual foods and rank them by the spotlight system. And I think that food banks and food pantries are really doing a great job as part of the food system, and making sure that the foods that are distributing and they seek in donations and in purchases are the foods that are the most nutritious value possible.
I appreciate this conversation around the food environment. I want to come back to what Tammy and Susan were pointing out. I don't want us to skim over that or it not to be highlighted. But when we're looking at inequities in the food environment, it's important to kind of name those things. And so if you don't have a vehicle, so Connecticut is very different than other states, right? We're small, we're tiny, we're mighty, but we don't have the kind of infrastructure and transportation systems that you might have in New York City, right? I grew up in New York City, so, and we were also people who had a local grocery store, but we didn't have a lot of options. It was that one grocery store, it was Key Food, and we had to walk there or take our shopping carts, right? And so in Connecticut, we have communities and neighborhoods that don't even have sidewalks. Right? So if you don't have a car, you can't afford an Uber, you don't have a sidewalk, how are you getting access to food, right? There's some inequities that exist, and we really have to name those things and really start calling it out and calling people in to help us with those issues, right? We're not even talking about weather stuff. We're talking about access to getting to a grocery store. And also we really need to look at, as we continue to develop within Connecticut, so we're talking to the economic development folks here, right? Can we put some supermarkets in communities, right? Can we make sure that we have healthy access to food in communities that maybe are not the ones that are getting the new housing developments that might have 10 or 20% affordable housing. We're talking about communities that are already existing, right, that we're working on, that we're trying to beautify. But can we beautify by putting a grocery store there, right? Can we beautify by giving folks in these communities, these disenfranchised communities, these communities that we're really not naming? And I want to name it, right? This is part of the work that we have to name what's needed. And I think we're not talking enough about transportation. We're not talking enough about buses, right? Can we get buses to go from communities to the places where food are? If you're not going to put the grocery stores in the community, can we get buses to take us to those places, right? So I just want to name that. I don't want you to think that we didn't hear. I'm hearing you loud and clear, but we also want to name it for the recording and for the wonderful policymakers that are in the room. Because if not everyone has a car, we can't just pretend, and we can't pretend it's easy as getting an Uber. The money that I spend on an Uber is probably the money I need to be spending on food. Right. And so I just want to name that the food environment, there are a lot of inequities that exist, and we have to really get to the work of trying to mitigate some of those inequities.
Well, I just wanted to chime in. Thank you for highlighting that, Melvette. With the work that Tammy and I do with CFAN, Coordinated Food Assistant Expert, we recently received $349,000 from the city of New Haven. The first time they had spent money on the food system in New Haven history. Well, just about. But anyway, what we're doing now is we're working on, as far as grocery stores, or the grocery stores like Ben runs are still a ways in the future, but providing the food pantries with more produce, giving them money to have access to more produce, more equipment that they can keep cold storage. We're working on getting small grants for them so they can add to that. And part of that is also to try and get bus passes to the pantry, so when people need to get, because a lot of times even though there is a bus, you might not have bus fare. So, having the pantries provide bus passes to their clients in order to come and go. They'd be all-day bus passes, so they can go from one pantry to another. So these are some of the things that we're working on in New Haven as well, because we do have food deserts there as well. And we're trying to get more, growers, more local growers. There are gardens all over New Haven that are not being utilized the way they should, that are providing lots and lots of vegetables and fruits during the growing season in Connecticut, which is much shorter than other parts of the country. But still, there's a lot of programs and work going on that's trying to lift this work up. So thank you for mentioning that.
Thank you all. And everyone at this table has already said it better than I ever could, but I do want to belabor this point for just a moment because I think it's that important. And I think sometimes when having conversations like this, it can be very easy to unintentionally slide into this narrative that blames individuals for, their chronic health conditions, for their food insecurity, or for over-consuming, items that, may not be the most nutritious, but are the most affordable. And I want to just explicitly name that that is absolutely not what I want anyone to take away from this event. And we just had all the panelists label all of the structural barriers that are in the way: accessibility, affordability, transportation, weather, advertising. And also, just to name, we've been talking a lot about information today, but that information is not always structurally easily available either. Ben made this point earlier. I certainly know that a lot of times when I'm shopping, I don't necessarily have half an hour to read every single label and look through, or to scan the QR codes. And a lot of this stuff can be buried, or it can be, in one of the aisles that's tucked away. excuse me, that's tucked away. And especially, if you're an individual who needs to make that bus to get home, like you can't necessarily don't always have the option to spend an extra 25 or 30 minutes, or if you got to get to work. So I think it's really important to name that information access is important, but one, that information is not always accessible and it needs to be. And even when it is, it's half the battle. Because knowing which foods to select is really, really great, but it doesn't always have the most impact if the foods that you know to select are unaffordable. And so we've talked a lot about challenges, but I do want to make sure that we touch on some of the really great work that our panelists and Connecticut in general is doing. So Olivia, I'm going to throw this to you first. I know we've mentioned SWAP a few times, but would you mind just explaining in depth how this operates and how this can break down some of those information barriers for consumers?
Yeah, definitely. So SWAP, again, supporting wellness at pantries, and the overarching goal is really to think about how we can promote healthy food choices at our level at the food bank, and then trickling that down to our food pantry partners. So the purpose of it is to be a very simple, intuitive, transparent system that could be used to rank foods across all different food groups. So again, taking a look at the saturated fat, the sodium, and the added sugar, like I mentioned in the beginning, that's how SWAP works. Just again, because it's most likely to contribute to those diet-related conditions that we've been talking about. So for us at the food bank, we rank all of our inventory, like Dr. Maria was alluding to before. We rank every single item that comes in, and we use SWAP to help inform the choices that we're making when we are purchasing food. And also to think about, the donations that we would like to bring into our warehouse as well. So that's how we're ranking our inventory. And then that allows our partners to have this additional tool that they can use when they're placing orders from us. So when our pantry partners place orders from us, there is a spot that emphasizes nutrition, and it clearly indicates the SWAP ranking for that item. So again, just that additional tool that pantry coordinators can use to help them think about the food items that they want to be bringing into their space in the first place. And then, like I mentioned, we do train our partners that are interested in implementing SWAP in their programs. So then when they implement SWAP in their programs, they're putting up shelf tags, green, yellow, and red. They're thinking about how can I rework my space a little to have the green ranked items like more at an eye level and things like that, to think about the environment of that space. So then neighbors that are shopping in that space can use those shelf tags as this additional tool for them to try to quickly and conveniently understand nutrition of a food item. So that's kind of the purpose of SWAP and how we're working to just have it be an educational tool that pantry coordinators can use and then neighbors can use when they are shopping in their space. But again, we never want to be imposing shame on the food choices people are making. People can select whatever choice they want to make, and that's the dignity that comes with it, right? So for us, SWAP is just, again, giving that educational tool so that people can have it and they can see the labels and they can use that to then make informed decisions when they're shopping for themselves and their families, whatever that informed decision may be for them.
Yeah, I just want to build on that. I think, the SWAP system is a really great one. We've adopted it again in our retail grocery. I would love to see more grocery stores adopt similar models because I think it's such an easy approach. But I'd also encourage consumers that yes, sometimes information is hard to access, but we do have Google. And so to become curious about what we eat and become curious, not to the point of becoming stuck, in an hour shopping, but it's worth, you can look up quick recipes, you can look up quick, how this works, what's better than that, what's a good substitute for something. And again, even as a chef, I don't know everything about food, so I often pull out my phone while shopping and, hey, what's this product I haven't seen, or what's this grain, and how can I use it? And so, there is a little bit of a sense of curiosity about our food that could go a long way.
Yeah, absolutely. And one thing that I do want to make sure all of our audience knows that is really important about SWAP is that this is a Connecticut-developed resource that is now nationally renowned. The U.S. Department of Agriculture has a page encouraging the use of SWAP on their website. Feeding America, correct me if I'm wrong, I believe they also encourage its use.
Yeah. So it stemmed from Connecticut, but food banks and food pantries across the country are utilizing this as a tool when we're thinking about, our food assistance network and how we can, promote those healthy items and help folks have that access to the nutrition and then access to those healthful items in those spaces. So yeah.
Wanted to add, we used them in New Haven in the food pantries as well as part of CFAN. The members of CFAN are asked if they would like to join SWAP, and they are offered an incentive in order to be trained to do it. So now there are 10 pantries that use them all the time, and what they have now, they've added on to that, is a train the trainer program. So the original members that learned how to do the SWAP system in their pantries are now training other pantries in order to use it as well to spread the message and spread the good work.
Yeah, that's awesome. SWAP is, again, it's a very simple thing to learn once you've learned it. So it is a very train-the-trainer type system. And I first, when I was in grad school, I was working in New Haven, working with CARE, implementing SWAPs. And that's kind of full circle for me. I'm doing it at the food bank. But so I've been doing SWAP for a while. I know there's a lot of good stuff happening in New Haven with SWAP pantries.
And just one of the things I think that's really powerful about it, to reemphasize the point that's been made several times, but worth reiterating, is that it is about choice, right? And so it's a non-judgmental approach to it, right? And it allows you to make choices, which is, I think, is really what information is about, is helping people make choices, and there are a variety of factors that go into those choices. And if you looked at my pantry, you'll see red items, right? And I choose those items knowing that they're red, and I try to limit them. But I use them because sometimes they're delicious and convenient and affordable and they make sense, and sometimes I just like them. But the point is that it's about that choice and information.
Yeah, absolutely. And so just to reiterate a few things. One, I just wanted to highlight that and make sure that, Connecticut Foodshare and UConn deserve shout outs for so many things, but I did want to make sure that they got that recognition for really being instrumental in this hugely important tool. The second thing, kind of touching on what Ben said, one of the really powerful things about labeling is that it can provide that, information is power, and it can provide that information without taking away the choice. It's not saying you can't choose this, it's just saying, here's the information that you as a consumer may need to know to make the informed choice about what's going to be best for you in your household. And Ben, I did just want to briefly touch on one follow-up. As a grocery store, how easy or hard was this to implement?
So honestly, it was really simple. So Connecticut Foodshare came out and worked with our core staff. I think we set aside a couple hours. We didn't even need that whole time, but and now we train our staff in it. Every new item that comes in, we can do it. It was honestly really simple. They make it really simple and accessible, and so this would not be a heavy lift for anyone.
Awesome. Alrighty, we are exactly on time, which I am so excited about. Sorry to break the fourth wall for a minute, but we are now on to our last question. And so I just wanted to give everyone, and I'll start with Claudia and go the other direction, but just as a final question for everyone. We've talked a lot about, the importance of information and also the barriers to getting that information. So as one last thought, how do you think we can expand access to this information so that consumers are empowered to make their own informed choices?
So I think we should be making the healthy choices the easiest choices for everyone. We should be having fresh fruits, vegetables, all these healthy food readily available for everyone. Doesn't matter where we live. So maybe having it at convenience stores, grocery stores, that should be the easiest choice for everybody to make. And I love the swap system. I would love to see that at every grocery store. I know that might not be possible, but that would be a great idea. That would make things easier for every consumer to just go to the store, grab the green things most of the time. But I think that would be something great to see.
Information is great, but without choice and accessibility, it doesn't really help. So I think addressing the accessibility issues are really critical. And then again, not to reiterate, kind of beat a dead horse on this one, but SWAP is so simple and so scalable, and it'd be great to think through from a policy perspective how do we incentivize retail stores to use the system and create a more universal approach to that?
Yeah, I believe that everything we are discussing here are important to empower consumers to make better decisions. And I would love to see more transparent labeling in foods. And I think there is an opportunity to flag those products that are the most harmful, that have the additives that we don't want to have in our diets. And there are so many examples of warning labels all over the world that are really being effective in informing consumers of what is in the food they are selecting. And especially when you think about what is in the food supply, in the US food supply, 70% of the food supply is ultra-processed. So think about it. So it's an opportunity also to work with food companies that are making those foods and reformulation and take away those additives that should not be in the food. So, and the other things are the public education for consumers. The more we talk about it, the better. It's almost like we're talking about this is not an individual really burden. We should think about the food system. And I think all of this working together will help us to remove the foods that are not good for us from our table.
I would just say, first of all, make the nutritional fact label more easy to access and have more clarity. It's sort of gobbledygook if you don't know what you're looking at. And also more information, nutritional information and nutrition classes. I said this before for SNAP recipients or others, those in with chronic conditions in the from the healthcare field, so you know what is healthy. It's okay to go to the store and look at stuff and that looks healthy, but is it? If you don't know what you're looking for, and that has a lot of choice change. Well, I lost my train of thought. Sorry, but what you choose is based on what you know, and if you don't know if it's healthy, if you don't know how to see if it's healthy or not, it makes a difference with your choices.
Yeah, pretty much I was going to say too, is more education about, the food labels and how to read them, what to know what's on them in foods. Also the swap, that's, I think a lot of people need to learn that too. And accessibility to transportation like we were talking about earlier.
I think everything that everyone has said has been great things. So I'll just add, continuing to normalize the topic and normalize these conversations. And, like Melvette and Christian were saying, name these things. We need to name the inequities that are occurring in our state and think about how we can work towards, creating a more equitable environment.
Thank you all so much. And I'm going to just ask if we can give a quick round of applause for our amazing panelists today. Alrighty, and now we are coming towards the end of our event, but I did just want to briefly stop and do another round of thank yous and recognitions. I wanted to first recognize our legislative leaders. So I know in the room we have Representative Turco, and then I can't see the Zoom room right now, but I do know that Senator Anwar and Representative Collins Maine had both said they plan to join virtually. So if you're there, thank you so much. We really appreciate all of you being here for this really important conversation. I also want to thank a lot of our executive agency representatives who are here in the room with us today. We really appreciate you being here with us. And all of you, thank you so much for taking the time to come out and be a part of this conversation today.